Hi everybody. My name's Andy Fraser. As Katie said, I'm the business science manager to University Hospital North Midlands. I'll whiz through these as quickly as I can. So this is a slide from last year. It's just to demonstrate we're a large acute hospital based in Stoke-on-Trent and Stafford. Last year we elected to be a pilot site. This is part of the pre-admissions of patients, a pilot site for digital weight management with NHS England. We're one of a handful of trusts. And it was really to support our patients with weight loss and all the improvements that brings. At the time of doing this, based on the eligibility criteria, we had 2,226 patients on our waiting list who we wanted to review. This was going to be quite manually intensive, so we wanted a automated method to do this, and an automated method that was going to be dynamic, so it will grow with us as an organisation into future things as well. We wanted to use tools that was available to us, and part of that tool set you'll see is Patient Knows Best. So we designed the approach. It's a fairly complex design, so just to demonstrate it a bit more simply, I've got a little animation. It starts off by looking at the trust waiting list, which is our data warehouse. Let's say we pull out those patients that meet the eligibility criteria. As the process runs, every day new patients get added into the waiting list, so we'll pull those out. But when we first turned this on, as I said, we pulled out over 2,200 patients. Those patients all go into a database that we use to control the process. And alongside that, we pull data out of various other systems, data that are systems that hold the patient's heights and weights. We look at readings going back up to 2 years, on the belief that the patient's not likely to have lost significant weight or gained or lost height in that time. So those two elements together allow us to calculate the BMI. Okay, so knowing the patient's BMI was part of the criteria. They depending on ethnicity, you had to be a minimum of, I can't remember the number actually, of a certain BMI that we were then able to offer a referral to the weight loss scheme. So if the patient didn't meet that criteria, the journey ends there. We don't contact the patient. If for any reason we don't know the BMI, or we know that their BMI is certainly above that threshold, we instigate a questionnaire to the patient. So we're using APIs to generate this, and those APIs are being called from our data set. So we're triggering that request, which goes into Patient Knows Best. Patient Knows Best then messages the patient. We ask the patient for their height, weight, and consent. The questionnaire we send depends on whether we know their height and weight already. In which case it probably just be a consent that we send out. Those responses, again, we use APIs to interact with the patient responses, and those get pulled into our control database. So we've now got all of the elements to determine whether that patient should be referred or not. The key thing is the patient consent. So if they meet criteria and they do consent, we've got a little RPA process that runs and picks up in batch that list of patients for the day. The referrals are made through a website, the NHS England hosted website. So the robot simply takes our list and keys all the patient details into the website. It goes to NHS England. At every point of this journey, we write back to our control database, and that lets us do various reports, dashboards that just look over the process as it's running. We implemented this successfully. the initial backlog, over 2,200 patients, was cleared within the first week. We've learnt from other trusts doing this manually. It was taking upwards of 20 minutes per phone call. So working on the 20-minute basis, that equates to 136 days of time savings on those phone calls. That was at the onset. We've now screened 5,191 patients as of last week. So you could almost double the amount of days of time saving. The reality is, though, that there was concentrated effort on day one, and as you can see from the chart, it's ones and twos being referred subsequent to that, when the waitlist is refreshed every day. Those ones and twos represent roughly 6% of eligible patients who we poll. So there's an awful lot of work here. We've reviewed 5,191 patients. There's an awful lot of work here just to identify those 334 patients that we referred. Very, very efficient to do this manually. So we're really pleased with this process overall. We've learned some other insights, such as the obesity rate of our patients, which is quite high, as you can see. So it's had positive impacts on patients and services within the trust. It's reducing length of stay, patients improve quality of life, and so on. There's a few. There was one main snag, I would say, with the process, and that's that we can only contact patients who are registered with Patient Knows Best. So on that basis, we've been keen to progress this and move to the advanced questionnaires. The advanced questionnaires, they allow us to contact any patient who's known to PKB, and it also encourages them to register into the service. So this is new to us. It's not quite live yet, but we're building a system locally to integrate the APIs with Patient Knows Best and to collect those results back. Now, those, as we've just demonstrated on the weight management, the triggers for the questionnaires are generated by the database. It's also viable that a clinician could generate a questionnaire within the system as well, and this will be unknown to us. So with the new advanced questionnaires, the patient completes the questionnaire from whatever the source might be. We're then using the new APIs to collect responses of what's been completed since our last poll, and those all get fed into our database. We've got local logic that determines which ones we're interested in, which ones we're not interested in. And on that basis, we can then turn that into models that we can report from. Those models could either integrate with systems such as the weight management program, which we'll be doing very shortly with this version, or it's just available for reporting if consultants want to see the general themes of the responses that they've had for whatever their questions might be. So touched a little bit on the future already. You've mentioned waitlist validation. We don't presently use Patient Knows Best for that, but we're planning to put all of our services through this. We see it as a essential communication vehicle between the trust and patients. So yeah, and as I say, we're very much developing fast our adoption of the advanced questionnaires. And I think that's it. I'm open for the on time, Katie.
Really on time. Absolutely spot on. Thank you, Andrew. That was great.